the heart and soul behind every business. Stories. Welcome to Business Story of the Week, hosted by me, Joshua Laurie. From setbacks to comebacks, from tragedies to triumphs, we inspire entrepreneurs through conversations that matter. Witness the magic that turns dreams into reality. Whether it's your career, business, or life, your success is always one story away. This is Business Story of the Week.
Hi, my name is Sayed Sadiki, and welcome to Business Story of the Week.
Fantastic. And that is the man himself, Sayed Sadiki. He's our guest for today. I'm Joshua. I'm your host. Sayed, what happens when healthcare meets strategy? Is there a lot more room for strategy innovation when it comes to healthcare?
Yeah, so I've been able to speak with a lot of patients. I currently work at Jefferson Health, and I work in a sort of like an operational type of role. So I was able to talk to a lot of patients, and there's always going to be a complaint, because end of the day, we are sort of, when it comes to patient experience, we're sort of customer experience as well. And you're always going to get some complaints. And it wasn't just me who heard some complaints. Any administrator I would talk to, or any doctor, or anyone working in healthcare, even just friends or patients, someone has some criticism on the healthcare industry and how things are running. Well, whether it's prices are too high, whether it's wait times are too long, anything like that. I think there's always space for improvement, especially with some issues, because since people are already vocal about these issues, such as wait times and prices, you just know that there's a way to make a change where these issues can be solved. We're lucky to be in a position where people tell us the issues, It's
That's
our
it.
job to figure out how to strategize and overcome these issues.
I love that. I love that opening up with that right there because it's innovation is what we're really going to talk about right there, especially particularly healthcare innovations and what room do we have left into doing that. Of course, there's always room for improvement. And Sayed is going to be talking to us about that today. Is going to be unraveling that and more. Sayed Siddiqui is an administrator for the Facial Plastic and Reconstructive Surgery Division over at Jefferson Health. He also founded the American Journal of Healthcare Strategy and serves as the legislative ambassador for the American Cancer Society, advocating for cancer prevention and treatment policies, and so much more. Ed is also is the chairman of the American Journal Healthcare Strategy again, and founded alongside a group of physician administrators in 2023. Syed, thank you for coming on to the show. I'm quite excited about what we're talking about today. But before that, before we really get deep into this, I wanted to ask, what was the young Syed Siddiqui like? What was the young Syed like? Did he always know he was going to get into healthcare? And really, did you always know that you were going to diving into the world of healthcare strategy?
Well, first off, thank you for bringing me on board, Joshua. I really appreciate it. I'm very honored to be here. I guess a young Saeed Siddiqui is weird because I still consider myself young. When I was younger, my father, he's a doctor. He works in public health. My mother, she works on the administrative side in nonprofits and HR that deals with health. So I was always like sort of put into this whole idea of healthcare. I grew up with both my parents always discussing work at home, and I just learned the things about the healthcare industry from there. When I was going to college, it wasn't really. I didn't know I was going to start a journal. I didn't know I was going to work in healthcare administration. I actually went to college for philosophy. I had no idea what
Wow.
I wanted to do, but I was interested in philosophy, and that's why I went that route. I got a job part time over at Jefferson Health as a contractor, and I loved the job so much. Immediately following graduation, I had some friends that went through a few months of not being able to find a job. Fortunately, the guys at Jefferson Health have been very, very kind to me, and the day of graduation, I was offered a job there. So that's really great. From there, I actually was given a position to help. make changes, suggest changes to our manager and the directors of the practice. And after seeing the impact of some of these strategies that I could suggest, the impacts of those on the patients themselves, I decided, hey, what if I wrote about this and several other administrators could really read about it, implement it in their own practice? I didn't find that many journals out there where I could document my research findings on or like talk about this huge strategy. So I decided, hey, why not create a journal like that? And that's how we ended up
Wow.
with American Journal of Healthcare
Wow.
Strategy.
That's quite the story. I love how that kind of unfolded for you, especially taking up philosophy as well. It's kind of completely completely off tangent. Like it's not even nowhere even close. But again, it's like these things kind of they do happen. They kind of fall into your lap as well. But you make the most out of it. Did you feel like you've always had some form of passion when it came to healthcare, so to speak? Did you feel like soon as the opportunities presented itself to you, it was easy for you to follow that path? Did it feel natural to you?
Yeah, I've always been interested in improving patient lives, and obviously we're all a patient ourselves. Everyone needs to go to the doctors at some point. I'm lucky to be in a position where I can actually make changes that impact patients and their experiences in the hospitals. So understanding things from the patient side and understanding things from the administrator side, I'm able to sort of learn about the issues that are going on that patients experience and actually implement solutions for as an administrator. So I think it's a really cool position to be in, especially since I can help everyone in this sense. But yeah, I'm excited. It's been a great career so far, and everyone's been really nice to me in the field.
I mean, it's pretty cool as well. Again, it's a unique opportunity. I feel like it's like there's so many stories and so many opportunities just to come out of it. You manage a, a fellowship program as well. You manage a research program as well. Again, all in the facial plastic surgery field. Talk to us a bit about that intersection. Again, you talked about like administrative role, being able to make changes, and being really involved in the field as well. Talk to us about that intersection where the clinical and the research sides come together, and what have you learned from balancing both?
Yeah, so I was basically mentored by one of the facial plastic surgeons over at Jefferson Health, and he's been very kind to me, and he actually wants me to get these opportunities to learn and grow, and he got me involved. I was working on the in the clinical side sort of during my part-time working during college. And once I got this full-time position, he actually had me getting more involved with the research side of things. I get to join meetings with him as different medical students, residents, different doctors. They all discuss research ideas, how to go about conducting research. And it's an important intersection because in order to learn more through research, I feel like you need the foundational understanding. And that's why these doctors, they already have this foundational understanding from the clinical sense. And since they already understand this, they can now go searching for more. So being able to see the individuals that already have this foundation and can go searching for more, I think is truly amazing, especially what they discover, how they go
Right,
about discovering it. I think that's the most
right.
interesting part to me. Just the statistical side, reviewing data, and planning a course on how to find out something that you don't even know exists.
I love that. It almost feels like there's a lot of moving parts, of course, when it comes to the healthcare industry now. Do you feel like I guess with your experience in facial plastic surgery, how does it translate into a larger picture when it comes to healthcare innovation? Do you feel like there's a lot of commonalities in there, and really give us a bigger picture, sort of like how does this experience translate into being involved into a wider innovations in the healthcare?
Yeah, that's a good question. I usually joke that plastic surgery is sort of that weird field where you'll see a patient who's coming in for, say, just for Botox,
Mhm.
just like nothing unusual, just like, hey, I have no issues. I just want some Botox to take away some wrinkles. And the patient right after is someone that comes in with no nose,
Uh,
just because they had mass resection from cancer. And just seeing both spectrums of this healthcare field where you have patients that have nothing going on versus patients that severely need surgery like within the next week or two, or some bad things can happen. I think it's really cool to see both of these intersections and also one after the other,
of
literally
course.
like 5 minutes between patients. So you see both spectrums. So I think it does fit into the bigger picture in that you get to understand healthcare's role and also what can come of healthcare. It can definitely save lives. We all know that. You can go through life-saving surgeries, but at the same time you could also take it further and even go through just cosmetic things, some things that aren't necessarily due now or face the consequences. It's more so, hey, I just want to look a little bit prettier, and
Of
you
course.
just go in for Botox. I think it's very important to see both sides and note it, and I guess understand how far healthcare can go, especially with the advancements in the cosmetic side and also the life saving side.
I love that. I love that. And of course, again, it's the bigger picture. Like we're trying to complete the picture on here, and it's the cosmetic side and the life-saving side. There, of course, there's going to be a lot of overlap in there, which is why I understand, which is what you do as well as a chairman of the American Journal of Healthcare Strategy, which is a very, very important journal, by the way, a very, very important undertaking because these are conversations that needs to be had and that needs to be talked about in the healthcare industry. You highlight the importance of innovative policies, and again, these policies are, we kind of opened up with this in the start of the interview. Talk to us first of all, again, the inspiration. You talked a little bit about this earlier. The inspiration behind the journal as well, the inspiration behind these innovative policies, and again, how has it shaped the discourse around healthcare strategy?
Yeah, I think it's so the motivation was also partly that I've done enough research on different podcasts, different videos, and things like that. It's very rare to see a patient talking about some of the issues. Sometimes you will see a patient talking on a podcast or a video, and it's usually published by a hospital, and they're giving good reviews of that hospital. They don't really touch on the issues going on during their visits. So, a big motivation for the American Journal of Healthcare Strategy was also to give patients a voice. We not only cater to, I guess, executives. We do have several executives, early careerists, middle managers involved, those working in the field and actually have the power to make change. But we also have patients involved. So patients can state their issues, some things that they think should change. And since we have such a big following of different administrators throughout the healthcare industry, whether it's pharmaceuticals, insurance, hospital administration, these administrators who can make the change are listening to these patients. And a big
Yes.
point of American Journal of Healthcare Strategy was to give these patients a voice to reach a CEO of a hospital, or even just like CEO of an insurance organization. I feel like the CEOs, the C-suite, or even just middle managers, early careers, they all have the potential to make change. And if you're not listening to the patients themselves, who healthcare is supposed to cater for at the end of the day, then
Absolutely.
what sort of strategies are they really discussing? We need to find out the issues first. And these patients are the key to finding these issues. So American Journal of Healthcare Strategy was basically to give the patients a voice to actually reach those change makers and make those change makers listen to them.
Wow. I love that. I love that. And again, it feels like a puzzle. It feels like there's so many pieces to put together, and part of those pieces, like customer side, the patient side, and the healthcare side itself, right? And I love that you're giving a voice to the patient side because I think that's very important to have, and because how else are you going to improve things, right? But talking about a puzzle, talking about like if healthcare strategy was like a puzzle, and now you're talking about policies that we can innovate, policies that we can improve and change. Can you talk about a little bit more in-depth policies in particular that you feel are essential in order to complete the whole puzzle pictures? What do you feel are the more crucial policies that we need to innovate right now when it comes to the healthcare industry?
So that's a good question, and like you said, it's a puzzle. Every piece is definitely important. There are bigger pieces than the other pieces, so
Yes.
I think that some of the bigger pieces to complete a puzzle, I guess, would say a big part is access to care. Without if some people don't even have access to care, they won't even be able to talk about some issues because they don't really experience the issues because they don't have this access. So I think a big part is access to care, and obviously that once you open up that route, more puzzles open up within it. Um,
Yes.
who can get access to care? Do you need insurance? Should insurance even be there? What about people that are here legally? Should they be given care? What are the situations when you deny care? There's so many puzzles in that, and a lot of debates. I think it really just comes down to the classic saying of "do no harm."
Right.
Um,
Right.
don't hurt anyone, and I do think pretty much everyone deserves care. Regardless of what's going on. And there are several doctors and nurses and physician assistants, multiple people, several allied health professionals who follow this, and they will not deny care no matter what. A human is a human, and I think that's one of the biggest parts, just having that understood throughout the community.
Basically making healthcare a lot more accessible, so to speak, like making it like truly no one should be denied care. That's the bottom line, right? And do you feel like we've got a long way to go with that? Do you feel like we're denying too many care people? A lot more denied care right now than ever before. Do you feel like we've gotten better at that?
I don't think that we're denying care in a sense, but I think it is harder to come by for some individuals.
Hmm.
So, say say you're making minimum wage, you don't make enough money, you're not given health insurance. How do you go about care? Say one of your family members is diagnosed with cancer, right? You're the only one working in a family. They need someone to take them to the hospital. Now you're in a dilemma. You're either choosing, should I work 8 to 10 hours today, make some money to put food on the table, or should I skip work and not even get paid just to
Hmm.
take my family member to care, or
Yeah.
even yourself to care? No human should be given that choice. Choosing between giving care versus having dinner to eat. I think there are several issues going on, and I think that is one of the bigger pictures to keep in mind when shaping the healthcare industry. Like I said, it does get more complicated, and there are many more professionals out there that know a little bit more in depth and will definitely come at me for saying some stuff, saying I don't understand the economics of the
Hmm.
country, or I don't understand things from this side. But I think just to simplify things, my view is that no person should have to choose between giving care and eating dinner that night. They should be able to do both and not be punished for it.
I love that. I love that. And I think that everyone wants to achieve the same things. People just want to go about it differently. People might have different perspectives on it. But of course, we all just want the same. Like, we want the healthcare to be more accessible. Like you said, not having to choose between dinner or healthcare. And again, I don't think anyone wants that, doesn't want that for everyone. Who wouldn't, right? Who doesn't want that? Again, as an advocate and as a chairman of the journal, there's going to be a lot of discussion and discourse when it comes to healthcare strategies. What change do you hope to see in the future? Not just in cancer prevention, but maybe talk to us a little bit about that. But also treatment in general for the industry at large. How do you see, of course, also yourself? How do you see your role evolving in the future as you continue to be involved in all these innovations and all the discourse as well?
Well, something that I am excited for in the future, and I'm sure this is a very basic and overused answer, but just the technology, I do think is very, very fascinating. And that actually falls into like what I was saying earlier on how complicated it gets. If the hospital is not making enough money, right? How are you going to afford these like fancy technologies to improve care? So it sort of gets complicated in that sense. But I am excited for the advancement of different technologies. The use of AI in several different areas. Just like check-in kiosks, is definitely speeds up the whole process. There might be a little workings here and there where the kiosk might glitch. It might actually become uh, annoying at times, but I do think everything is advancing. It's definitely going to get to a point where very, very efficient and speeds up to the point where um, things are much better, no wait times. I am very excited for that in the future. As for my role, well, I don't do much except talk. So, I guess I would like to still have a say in the future. Maybe some policies regarding the use of AI,
Mhm.
the use of this technology. Say there are every time there's an advancement, it brings about new issues. Say before we didn't even have a phone, now we have like a smartphone, and
Mhm.
we have some more issues going on with smartphones slowing down, not charging fast enough. So every
Mhm.
advancement comes with more issues. So I want to play a part in having a say in these issues, I guess.
I love that. And of course, again, like you said, like talking about it is important. Talking about it, having the conversation around it is very, very important. And I love that you continue to do that. You continue to do that for other people, especially patients that may not have a voice surrounding it. I think it's fantastic. And of course, again, say it. You are continuously putting that discourse around there. Very, very important to put out there. Sayed, we'd love to learn more. If we'd love to connect with you, where can we find you? Where can we connect with you?
Well, you can definitely find me on LinkedIn, um, the journal website. Just come visit Jefferson Facial Plastics. You can find me in a lot of places. But I think the best way to connect would be through LinkedIn. And I invite
Right.
anyone who's interested or has any comments or like to get into a discussion. Like I said, I love to talk, so definitely reach out to me.
Absolutely. All right. Fantastic. To our audience and listeners out there, thank you so much. Of course, if you want to go check out Sayed, make sure to get connected with him on LinkedIn. Sayed, thank you so much for coming on to the show. I feel like this was a very, very important conversation to have, and thank you for always constantly talking about these very important topics, especially with the changes that we need to do over the healthcare industry, and of course for spearheading the journal, a very, very important place of discourse as well. Thank you so much for coming on to the show, Sayed.
Thank you for having me, Joshua, and letting me share my thoughts.
Fantastic. To all our audience and listeners out there, make sure to go connect with Sayed over at LinkedIn. Go let him know you found him here. Thank you for watching the episode. I hope you guys enjoyed it. We will see you on the next one. Bye bye.
All right, so here's the thing. We try to get a little bit better every day, but we can't do it without you. So if you like the video, make sure to like and subscribe below. And if you have any comments, just leave them in the space under.